Now, can I have female MO female revitalization while breastfeeding? I saw no reason why you can't. You can do that. I sincerely think every woman who have conceived after 1 or 2 months, they have to start the revitalization, because there was a totally chaotic situation of hormonal changes when the mother was carrying the baby. It's still a foreign element to the mother. Okay, that's why on the 9th month, the mother have to kick the baby out, because the system cannot take anymore. That's why the baby had to come out. Okay, but after the baby coming out, the mother is still not having the balanced hormones in the body. That's why we need to look at the hormonal level. We have to fine tune the hormonal level and move it back to the normal stage. We have to normalize the hormonal level. Okay, you notice a lot of women will put on a lot of weight or shape, or they change everything. A lot of things are changing. It's true, a lot of things are changing. Okay, and a lot of things are aging. The woman age very fast after birth of a child. So we have to take care of all the organs. So female revitalization is something wonderful. It's not expensive. It's the average price for the average people. They can do that. Of course, if someone to tell me what is the best thing then, of course the stem cell will be the best thing, because you need 60 into 1, whereas here is 1:30. Which one will work faster? Obviously, the one will be faster. 60 to make into 1 5 ml, and here you're making 1:30 to 40. That is the difference, okay? But again, I will always say, don't delay. I will always say don't delay, because the longer you delay, the more harder it is to fine-tune yourself and to revitalize. We must regenerate, we must revitalize, we must rejuvenate. So 1 month after delivery, I'm totally fine with it, I would say. I'm totally fine. In my opinion, I'm totally fine. So again, you can use the animal, you can use a human, you can use a vegetal. So that is also good. You have everything. Which is the best lab to do blood profile before starting revitalization? Now, the lab, there are so many labs lah. But if you want to do a lab, you always stick to the same lab lah. Because you have to do comparatives. Okay. You see, on our side, whenever we treat any stem cell patients or any patient with live cells, we will always say we want your last 3 months report. Okay, why we want that? Because after 4 months, we will ask you for another report, but preferably on the same lab. Okay, on the same lab, because you go to another lab, sometimes they have different parameters, especially in China and Hong Kong. They have different parameters, you know. So if you go to Griebers all the time, you go back to Griebers. You go to BP lab, you go back to BP lab. You go to some other labs, you go back to the same lab, PUB lab or whatever lab. Stick to the same lab, so the comparison is the same. Okay, so these are important for us, and there is nothing to say, oh, this is a better lab, that is a better lab lah. Okay, more. Now I always look at it in such a way. If I have a doubt in certain things, I may do 2 labs on the same day. That means I will ask the collection by my nurse to check my blood, and I do 2 labs at the same time. If I'm down on certain things, you know, I would like to check on, I will take 2 labs on certain thing if I'm because I'm afraid if there could be a human error. It did happen to me before. There was a human error, okay? And the other lab come up with a different result. Then you have to investigate, you know. But most of the time, humans are humans lah. We may have error lah. Okay, we can't stop that lah. Okay. Now maybe add more timeline example to see how long therapy takes from start to end. lifespan extension estimate. Now, again, you have to understand. Now, to answer this question, no one react the same way. Okay, no one react the same way. Please remember that. While you are having this patient having good result, let's say you have 10 diabetic patient or 10 autistic children you treat, you cannot say 10 will have the same result. But I will always say the patient we take up will have improvement. Because if the patient don't have improvement, we better don't take up. Because we are going to put our reputation at stake. Okay, and then we also affect our doctors who don't see the results. So I rather be very careful and make sure there is improvements. And I will always say improvement. I would not like to use the word cure. Cure is too strong a word to cure a person. The definition of cure is very hard to say. And there is no guarantee in medicine. So there is no guarantee. But when we say we see the improvement, through my general experience, through our expert team, we see all this. These are factual. I like to say something which is factual. I don't want to say something like giving too much hope and it won't happen. That means it's also a false hope. We have to be positive, but we can't give a false hope too, you know. So we will always say to a certain extent, this is our experience from where to where, how is it? So it's like a CKD. Recently, I have a doctor who asked me on CKD, you know, and he was asking, I saw the video by Dr. Michael. My patient would like to have the same result like him, okay? But we have to look at the condition of the patient, you know. While Michael may have it, I call it a miracle. It can happen to some too. Okay, I will not say no, but I cannot say everyone will have the same like Michael. Can you imagine Michael is becoming like normal? Okay, and he is there. He's all around there. He's still there. That is also something very unusual for many. Okay, so do you have clinics in USA now? We are working with someone to build a clinic in Florida. Okay, in fact, I have a few offers to build in Florida. There may be one coming, obviously one is coming up in Tijuana, the border to Los Angeles, Santiago, across the border. We are going to build a manufacturing plant there too, to cut down costs, you know. And so you can go there. I mean, of course, you can fly to Kota Kinabalu. You can still be treated in KL. We have clinics in KL, okay? We have a very equipped clinic in KL. We have two clinics in KL, okay? One is a very equipped clinic where you have all the devices, okay? Because I always believe you must be very equipped. You must have the best clinician. You must have very equipped. You must have the best therapy. Then you will keep your client. Because clients can run away. You have to give good service. You have to have the ambience too. Imagine you have so many you have, okay? Because clients have choices. And it's a very competitive world, even for doctors, even for aesthetic doctors or medical doctors, or, you know, it's so competitive even for anti-aging doctors now. Okay, aesthetic doctors used to be very good. Now they're also very competitive. A lot of them move into wellness. And people like us are totally in wellness. Okay, we spend all the decades in wellness. But of course, we also we have aesthetic doctors in our team. But although we have aesthetic doctor, we don't do surgery, you see. Although my Greece center does have a plastic surgeon, he does plastic surgery there. But our other center don't do plastic surgery. So the important thing is that you must have the good protocols, the good right therapy to treat. You give the wrong protocols, the wrong recommendation, of course it won't work. Like I say, you throw the dart, it didn't hit the bull eye, you know, because it wasn't the right one, and some of them don't even hit the dartboard. So you don't hit the dartboard means it was a wrong protocol given and it didn't hit and you don't get the results. But if you try and throw and everyone sharp to the point, that means your diagnosis was very good. You have a very good diagnosis. So you are the treating doctor, okay? You already have a diagnosis with you, okay? Nothing wrong to send over. I think in my opinion, can you give a look into that, you know, your medical team? My medical team will assist free of charge, okay? I would like my medical team to look through that. In our medical team, it will be a team of 6 doctors. They may be looking at that. They will give their opinion among them. Then the medical director have to sign off, okay? We go in that way. That means you have more brains to come up with solution and you can brainstorm better. And we respond within 24 to 48 hours. Very difficult situation. We may have to look for a specialist. Then I have to give a call to somewhere else, you know. I will always make in such a way that I may be asking the same doctor the same question, different doctor the same question, because I like to hear. You see, I can also ask the same question to 7 doctors of mine, and I like to hear how they answer it. That is the way, is it? But if 7 of the doctors, 6 of them say you should do it this way, that means there's some relevance in it, and everyone is in this field, you see. Everyone has been experienced enough. Yes, some are older, they have more experience. Again, I can check with my German doctors, my Swiss doctors, my American doctors, because we have clinics all over the world, so we can check with them. They will have their experience too, you know. So it's a sharing experience, it's important. So again, for those who are in USA, we have so many American patients. So I would suggest for the American patients, if they do not want to come to Europe, let's say to Greece, okay, they don't want to go to Greece, they can, if they insist they want to come to Malaysia, I'm fine. I have a lot of American doctors or even German patients coming to KK. I have a German patient who stay 1 hour from our German clinic. He insists he want to come to KK because he want to have the treatment when Mike is there. So I say, okay, it's up to you because he have a trust in me. You see, sometimes it's the trust. I have a lot of patients who say, Mike, it's okay. Where are you now? You just tell me where are you. As long as I see you, I know you do a good job because my job is to make sure I see some results. Otherwise, I'm not happy with myself. It's important. Because if you're going to, the client is going to pay a lot of concentration and he's going to pay you money, and at the end of the day, there is doubt on the treatment, then there's no point. So we also have to tell to what extent it may work, in my opinion, and our general opinion, and how long. Again, lifespan extension, you know. Now, lifespan, you cannot determine a fixed lifespan. The guy is a smoker, the other guy is a drinker, the guy don't sleep, the guy have a lot of stress. So all these are lifestyle expanding, going into the treatment. So I see some patients who did it every 3 years. I see some patients who do it every 2 years. I even see some patients who do it every 9 months. Very stressed patient. Okay, but when a patient is after 50, you know, it's good to do it every year if they can afford it. So affordability means you can use a 6-star, but you cannot afford, you can still do a 4-star. You know, you do a 4.5 star, it's still something there. It's better to be late than never. Okay, because your organ is aging like this. So when you do something, you go a bit of reversal, you go constant, and then you start to drop again. I do not want the dropping. The moment it drop means a lot of cells die. So I want to maintain it. So it's like an angry dog lashing out, you pull the dog. Each time you lash out, you pull. So that is what I'm trying to say. You do a reversal of aging and then you delay the progression of aging. You cannot stop aging totally. There's no way you can stop aging totally. If you say stopping aging totally is immortality, then like I say, senescent cells will increase and then cancer cells will step in. The more senescent cells you have in your body and you don't eradicate them, they will become cancer cells. This is my opinion, okay? So there is no fixed thing, but you will always feel it for yourself. You know, the patient will always feel it. And again, when we ask for the blood test report or the lab work, you know, with the hormone test, we already can see the comparatives. If some patient were to tell me, sometimes you also have patients say, I don't see anything, I want my money back. So it's good for you to do a blood test report, you know, and then 4 months later, insist on the blood test report. Even if you have to pay for the blood test report, it's good. You can package in such a way that I'm going to give you a blood test report on the 4th month, please come back. And you also like to know your progress, right? So you do a blood test report, or I can get the blood test from, I can send a nurse to you and get your blood. Then when I look through that, I compare the parameters, I have a word with you. You know, I can have a consultation with you, then I show you, you see, these are your profile before and after. That will not lie. That never lie. So that is an insurance for the physician to hold on. Because you may have some nasty patient, you know, who may complain they don't have any result. There's a situation like this, you know. So the promising part is important. I will not promise anything. I will not guarantee anything. I will not do that. I don't think it's good to promise or guarantee anything. Nothing is guaranteed in life. Nothing. Not just medicine. Nothing in life is guaranteed. Okay, we do not know whether we live to what age or even anything that happen tomorrow. Okay. Now, stem cells. I love stem cells so much. I study a lot of stem cells with my wife. We have been spending a lot of time on stem cells. When we say stem cells, we are not reading, doing our own stem cells. We also look at what the rest are doing in the world. We are learning from everyone. I'm always willing to learn. We have thousands and thousands of books. If you talk about autism, I think we have 200 books on autism. If you don't want to talk about diabetes, we probably have another 200 books on diabetes. That is how we go. We learn the books, we read the books. We also read how the other physician treat. What was the positive result of treating the patient? And if that protocols work, why don't you have it here? To me, it doesn't bother me whether it's Ayurveda, traditional Chinese medicine, or biological medicine, plus the conventional medicine. The important thing, it works. All we want is something which works, but first of all, first do no harm. No harm. There must not be any harm. Any harm means we are going against the situation. No harm, and then we want to see to what level it works. Again, dosage can be increased over time. Okay, if some people you think is too overdose, you start with a low dose first and observe. You can always observe. In the case of CKD patient, we give a quad dose, 4 times the dose of a normal person, because we try to save the kidney cells, the dying kidney cells. So we have to give a quad dose of the kidney cells and the epithelial cells. So we have to inject on the patient a double dose. We cannot inject a quad dose over the same time. And we observe over the next 20 to 24 hours of the patient, and see the response. She's doing okay, everything is okay. We inject the other 2 double dose. We are giving that as an extra. The patient don't know about it, but we tell the patient we want to give this. But this is subjected to us observation. Then you give the dose. Okay, and why we want to do that? Because we are racing against time to save the patient. You are racing against time. The patient may not be around. So when you race against time, you have to look at the best option. Okay, still we don't do it 4 at one time. We do it 2 and then tomorrow 2. Okay, because the cells are still alive within the 72 hours. All cells will be alive for 72 hours, but brain cells will die faster, and brain cells should be injected within 24 hours. Otherwise, they lose the potency very much. Okay, so these are the situation. Again, a lot of people will say these are stem cells, these are peptides. Now, don't believe everything about what people say. The best thing is I must have a documentation from you. If you say these are stem cells, show me the cell count. Show me the quantity, the type of the cells. What type of cells you have? You say you have this type of cells. Please show me. Are these cells or are these stem cells? You have to show, because people are just given something and they, sometimes the doctors are very busy. They will ask for indication and contraindication. But sometimes they never ask, hey, these are stem cells, these are cells, okay one, because of the trust. You see, so the the physician may not be given certain things. But sometimes it's good to provide that document, because it's good to ask for that document, because you can prove that how many cells are there, what type of cells are there. You have something to prove. So I always think for all the cells or all the patients, when you come to talk about frozen cells, live cells, or stem cells, I would like to give a COA, because it's like you buying a house. You must have an architect report, or you have an account of a business you want to take over. You must have an auditor report. You hold the auditor responsible. Here you have to hold the manufacturer responsible, because the provider for you may be giving you something and then tell you something else, and you are overcharged probably without you knowing. So if I hold you, you charge me an A price for a B, and you say this is A, this is B, so I can prove now whether it's A or B, and I also check with the price. Price, sometimes, okay, you charge a higher price, fair, but is this the right thing I'm asking for? Because there's a lot of difference between the prices. The difference between the stem cells and the live cells is 2.5 times cheaper. The difference between the live cells and the MO or the peptides is again much cheaper, 5 times cheaper. You see the difference, or 6 times cheaper. So a lot of variance here, Okay. So I would say there's a solution for everything to a certain extent. And there's also Not everyone will say, oh, I must do the stem cells, the 6-star. If you cannot afford the 6-star, then you take a lower range. You still see the results. That is important. Okay? All right? It is so kind of you to spend the time and the effort trying to educate and make us understand the subject, but it's too bad that I can't pay full attention during the Zoom meeting. I will visit you or PM you one of these days. Wonderful. Okay, you can always text me or anything else. My job is to provide. To provide means we are in a service industry. Service industry means you must give the best. Either you do it with the heart or you don't do it. You don't do it in your heart, you will lose a customer. Okay? I always tell my team here, for the managers who is servicing the physician, you must service the best. If the physician call you, you must answer the call. You don't answer the call 2 days later because he may need something urgent. And I make it a point, all the physicians can contact me directly. If my doctors is going to answer the question very slow, I will answer it straight. I have a situation of my Japanese team of doctors. You know, my Japanese doctors who ordered, they say that the answer is very slow. I told the Japanese doctors, you call me immediately. I will try to get you the answer as soon as possible. Just give me the answer. Question, you know, I will get the answer for you. Because sometimes you have an urgent need to answer. So you can always give me a missed call. When I heard a missed call, I know it's an urgent call. That means I have to contact you. Okay? But when you send a message, sometimes it's not an urgent message, then it's different. But you give me a missed call, I know it's very urgent already. I must call you back or I will text you immediately when I see it. Okay? Of course, with so many messages, sometimes I also miss out, you know, because I'm having so many phones. Okay? So I allocate the phones according to the urgency and the doctors. And I also have the email. There are around 80,000 email unread until now, although I'm reading every day, but there's still 80,000 unread because it keep accumulating. And the more you answer, the more replies come in again, you see. But I just try to do my best. Okay, I always try, and I expect my team of people to do the best too. And I expect the product to be a Rolls Royce. I always believe only in a Rolls Royce. The product must have the top quality. Bear in mind, all our products are manufactured the GMP way. Obviously, we have a biopharma plant, GMP, German. Okay, biopharma plant. It's very difficult to get a biopharma GMP plant. Now, the next thing is all our supplements, all our cosmeceuticals are insured with $1 million US. They have been insured for many years. We pay a high premium for it because it's under Swiss Chubb. Swiss Chubb is the world's largest insurance. It's not just the insurance for safe. Everyone remember Chubb for safe, but they are actually the world's largest insurance company. We insure under Swiss Chubb because we want it Swiss. Okay, our products are mostly Swiss made. So we want a Swiss brand and we want to make sure the quality is there. And the insurance company will not accept you unless you have a certain standard for your products. So you are very safe using the product with a product liability of $1 million US. For injectables, you can't insure because there's no insurance for injectable. There is no insurance, but one of these days, we will get insurance for all the doctors, even for injectables. We will work a way out. If all the doctors will group together, have a strong voice in the association, then we can work with the insurance company because we will have a stronger vocal voice. Then we will go with the doctors and the association and the insurance company to ask for insurance. Because now the doctors are not insured, they are doing everything on their own. It's high time we had to do something like this. Okay, we will go with that. This is one of our ultimate aim to go with that too.